Greetings and welcome back to Kage Los Angeles. We need to talk a little bit. We need to talk about the government shutdown. Of course, not the surface level political drama the media keeps feeding everyone, but what's really going on behind that curtain. Because this shutdown is not about budgets. This shutdown is not about politics. This shutdown is about power. It's about legacy, and it's about exposure. You know, it's funny because every time I turn on the news nowadays, there he is again. Not who you think I'm talking about. I'm talking about Barack Hussein Obama. He's not the president. He holds no elected office. So why is he everywhere? In interviews, in headlines, weighing in on policy. Why can't he just sit this one out? It sort of looks like his legacy is on the line. It looks like something is about to get exposed, and I think we all know exactly what that something is. It's the Affordable Care Act. It's Obamacare. Let's get into it. Now, this is the thing. Obamacare is not just a health policy. No, it's Barack Obama's legacy piece. It's what he wants to be remembered for. But what people don't understand is this. Obamacare didn't just change healthcare. No, it created a massive money pipeline. Hospitals, insurance companies, pharmaceutical corporations suddenly had a guaranteed stream of government, taxpayer, government dollars. Billions, not millions, billions. And now that legacy is staring straight down the barrel of a new threat. Trump's big, beautiful bill. Trump's big, beautiful bill, well, it rips up the funding structure underneath it. This isn't whether your premium goes up $10 a month. No, that's just a distraction. This is about dismantling the pipeline that it feeds. Hospitals, Big Pharma, insurance corporations. According to the Department of Health and Human Services, private insurance companies saw revenue from government programs increase over 300% from 2014 to 2022. 300%. And that, my dear friends, is why Obama is back. Not because he cares about your coverage. No, because his legacy and the money are on the line. Let's reminisce. When Obamacare first rolled out, very low-income Americans, well, at that time, they were relieved. People working 2 jobs, people waiting tables, folks raising kids alone with no coverage. Well, they finally had health insurance. Some only paid like $12 a month. Some paid nothing. Students, servers, single parents. For millions of Americans dealing with chronic issues, this was a lifeline. It wasn't perfect, but it was something. It worked. Just long enough to hook everyone in, because that affordability was the carrot on the stick. It was sort of like a teaser, a setup. Once everyone was dependent on the system, prices started climbing. In some states, premiums increased over 105% between 2013 and 2019. They got everyone addicted to the system, and then they jacked up the price. But of course, see, this is not healthcare. That's a deliberate bait and switch tactic. And here's the part that no one seems to talk about. Obamacare was not designed to help patients. It was designed to make corporations rich. Hospitals started getting paid on time. Big Pharma suddenly had millions of guaranteed customers. Insurance companies got new subsidized signups. From 2010 to 2020, U.S. healthcare spending ballooned from $2.6 trillion to almost $4 trillion a year. That explosion wasn't because people suddenly got healthier. It was because corporations got wealthier. And when billions of guaranteed government dollars flow through hospitals and drug companies, there is no incentive to make people healthier. Only to keep them medicated, push unnecessary procedures, and raise prices because insurance will cover it. People weren't the product. Patients became inventory. So, fast forward to today. Trump's big, beautiful bill threatens to cut off federal subsidies for undocumented immigrants, illegal aliens, and low-income enrollees. So if those people lose coverage, hospitals lose revenue, pharma loses prescriptions, insurance companies lose customers, and of course, Wall Street investors, the same ones who made billions gaming the system, well, they're sweating bullets. Right now, everyone in this system is in full panic mode because it was never about what people thought it was about. It was never about compassion. This was an upward wealth transfer, up, silent and legalized. And Trump's bill threatens to expose it. So you might be asking, what will happen when the subsidies shrink? Well, insurance companies will not absorb those losses. Of course not. They will pass the cost back to us. That $12 premium today, well, next year it could be $100. And the middle class Americans already paying $200 to $300 a month, they're going to get crushed. When that happens, the country erupts into another shouting match. It'll be left versus right. Then it'll be poor versus rich. Then it'll be citizen versus immigrant. Divided, distracted, irrational, emotional, while the real culprits remain untouched. Big corporations, Big Pharma, political puppets, media, manipulators. They will keep cashing checks behind the curtain. It's important for everyone to realize this. It's imperative. Obamacare was never about health. Many people complained. Many people saw the cracks. But mainstream media suppressed every criticism and protected the system like it was sacred. They sold it as compassion. They marketed it as progress. But it was never about health. It was always about power. They turned healthcare, the most human of issues, into a $1 trillion hostage situation. They distracted us with culture wars, with celebrity outrage, with manufactured division. Because if we're busy fighting each other, we'll never see them. Your enemy is not the person sitting next to you. Your enemy is big corporations, phony baloney politicians, media puppets, celebrity influencers paid to shape your beliefs, to propagate your mind. There is no we in this problem. There is only them. When we stop blaming each other and start exposing them, that's when everything changes.